students, and welcome back to Living with Mental Illness 101. I am your lecturer, Laqwanda Roberts-Buckley, and we're going to continue our discussion on self-advocacy in the Western mental health system. So last time we talked about who are these people, and now we're going to talk about where do I go for help? Well, where do you go for help can really depend on what you're actually experiencing. A lot of people don't know that there are two mental health systems that we generally operate in the Western medical system. There's a public mental health system and a private mental health system. You're like, Laqwanda, what does that mean? So let's start on the public side. The public side is usually ran by your state's Department of Behavioral Health, or may fall within your state's Department of Health or Department of Human Services. The name of the actual agency will vary from state to state to state. And within that state agency, they may be running something called your local community mental health centers. And so your local community health centers provide services to people within the community. Now, one thing you should know, the largest payer of mental health services in the United States is Medicaid. It is not private insurance. It is Medicaid. And a lot of the community mental health centers provide that care or services that someone may need. So your community mental health center can provide medication services, individual counseling, group counseling, case management, all for an example. You can also find within that system crisis centers. I'm a person that used to work for emergency services. We provided crisis service as well. So your local crisis response team may fall under that public mental health system, where they are under, again, that department or that state agency, Human Service, Department of Behavioral Health, Department of Health, however it may be identified within your particular state. Another aspect of treatment you may find in the public mental health system are your state hospitals or your state crisis centers. And so those, usually the state hospitals are usually reserved for someone that may be hospitalized involuntarily. Now, there is an array of things that can take place in that public mental health system, and it really differs state per state, where some people have access to case management and some people may not. So again, the public mental health system can vary state to state and even county to county. So that's really, really important. Now, on the private side, just a quick interjection here. I did not make this specific enough or clear, but the private side, this is where you're dealing with your businesses. A lot of private psychiatric services are ran by corporations. So these are psychiatric hospitals ran by corporations. On that side of the house, you'll still have services like outpatient therapy. When you go see your counselor or you are doing telehealth, that is called outpatient. That means you're not in a hospital, you're in an office setting. That is called outpatient therapy. It's individual therapy, but another term for it is outpatient. Now, for someone who may be experiencing more symptoms, they may go to a hospital. However, they're not staying in the hospital. They may be going to the hospital for what is called intensive outpatient therapy. And intensive outpatient therapy, someone may be going from 8 a.m. to 5 p.m. and they go home, or they may be going in the evening after they get off work, where someone is experiencing a lot of symptoms and may need more support, but they're not to the point to where they may need hospitalization, inpatient, where they're staying overnight. Another way that intensive outpatient therapy can be identified, sometimes it is called partial hospitalization, because you are physically going to a psychiatric hospital or a psychiatric unit and you are receiving services there. Now, inpatient hospitalization is when you are going, you get checked in, and you are staying overnight. And so inpatient hospitalization, the time that you are there really can range and really can vary. Not all psychiatric hospitals are the same. And what do I mean? Sometimes you have something that's called a freestanding hospital, and then you have a psychiatric hospital that's actually connected to a medical hospital. So what that means is that a freestanding hospital, the only thing that's there is the psychiatric hospital. The entire building is a psychiatric hospital. Whereas a hospital that's connected to a medical hospital, it may be a unit, for example, or it may be actually on a medical hospital campus. And those are different in terms of admissions. It's important to understand those because for some individuals, if they're also dealing with a physical health condition, they may not be able to be admitted to a freestanding psychiatric hospital because that hospital would not be able to provide or keep up with the medical care. So that's why sometimes, a person may not be admitted because those medical conditions that they may have may require them to have access or be in close range of a medical hospital. So they will be placed in a psychiatric unit that is connected to a medical hospital. And so that's when you may have your behavioral health wings, or if you go visit someone, sometimes you have to go through a hospital to get to where that person may be. Now that we know some of the places where mental health treatment takes place, next time we're going to discuss, how do I pay for all of this? All right, I'll see you soon.